share a whole lot of information and help us understand better about opioids and about synthetic opioids, where they're found, what they look like, and what we all can do to protect the children of Revere and children everywhere. So we're very thankful to Dr. Alex Wally, to Sarah Bagley, to Tracy Green, to Brittany Riley, who are going to really impart a lot of really important information to us tonight. They're all doctors and experts in their field. And I'll just quickly share our agenda, which gives a little bit more information about them. We're going to start off with a couple of just opening comments, and I've pretty much made mine. I'll run through the agenda, and then Mr. Bowen from the high school is going to have a few words. After that, Dr. Wally will talk about the trends in drugs for a few minutes, and then Dr. Bagley will talk about tips for parents and caregivers, and then Dr. Green will talk about the community response. We're hoping that all of this talking will be about 30 minutes, maybe a little bit longer than that. And then we have Julia Newhall, who is our director of the SUDI office, and Detective Sergeant Milton Alfaro, who heads up the drug unit at the Revere Police Department, who will be able to answer any questions of what's actually happening in Revere and what our community response is. And of course, the doctors will still be here to answer any questions that you have of a more technical or informational basis as well. I mean, all of them can answer a lot of the information, but we'll share the microphone a little bit at that point with everybody who's viewing. And just before we get started, a quick update for the community. I did check with the chief again today, and he said that the tests are still not back from the state lab. He said it could take several months as the state lab is pretty backed up with testing and demand. And so we're moving forward from the powder that we found in the high school a couple of weeks ago. And as students and parents know, we did work with local law enforcement to have the drug dogs and actually the firearm dogs as well do a sweep of the high school just to see where we are. That happened last Thursday, and we did identify a few places of concern. We did not find any drugs. We didn't find any firearms or hint of firearms. We did find hints of drugs. Mostly marijuana, and Mr. Bowen and his team are reaching out to the families involved and the students involved to see how we can, help them and intercede on their behalf. So about half an hour of talk and then another half hour of Q&A where people can bring their own questions to the forefront. And I'll toss it to Chris for a few words.
Thank you, Dr. Kelly. I just wanted to kind of use this opportunity as a school community to put forward the idea that the more that we can partner with families, with the community, and at the high school together, the better our students will be for that collaboration. And so, though I think this was a disturbing and unsettling discovery for all of us involved, I do hope that we can use that to launch some great collaboration between the high school administration, faculty, students, family, and the broader Revere community. So I'm excited about sort of some of this collaboration that has already started.
Right.
Thank you.
Julia, anything else before we jump into the education piece?
No, you just have the slideshow to share?
I do. Yep. I'm going to share that right now.
Great.
Of course, I'm hitting all kinds of wrong buttons here. Okay. So as I mentioned before, I just want to describe the picture at the right, and Julia could probably do a better job than I can of this, but every year the city of Revere takes a moment to reflect on the lives lost to opioid addiction and abuse. And so the picture that you see with the purple flags represent all of the friends and family members and citizens of Revere. I believe it's Revere, Julia, correct me if I'm wrong.
I think this is actually the city of Boston. I think this is their comments.
Okay, all right. So, but it's overwhelming to see the sea of purple and recognize the humanity that we've lost to this horrible scourge. And on the left, you'll see a better introduction of the folks who are going to be talking to us today, but they really are extremely esteemed professionals in the field, and we're very fortunate to have them here with us today. So I'll just go ahead and jump to the next slide. And as the presenters speak, if you want to tell me to move on, you can just say next slide and I will do that. So
great. Dr. Kelly, thanks so much. So it's really special to have this opportunity for us to talk to Revere. And as Dr. Kelly mentioned, that overdose is not something that's new to Massachusetts. That was the Boston Common, but there were 20,000 flags that were planted on August 29th of this year, which is annually Overdose Awareness Day. And each one of those flags represents a person, a Massachusetts resident who has been killed from overdose in the last 10 years. So my name's Alex Wally. I'm a general internist and addiction specialist at Boston Medical Center, and have worked actually with Brittany Riley, who's another person who's going to talk to you tonight from Massachusetts Department of Public Health. She's going to talk at the end, really, to give some information about state resources that are available to address overdose. So as I said, overdose is not anything new in Massachusetts. This is the number of opioid-related overdose deaths in Massachusetts residents. And you can see that the number of deaths was in the 500s and 600s until 2012, 2013, 2014, and so on up until 2016, when they went from essentially 600 overdose deaths a year, tripled to over 2,000. And we've been at over 2,000 for now the last 6 years. And that's a lot of overdose deaths. It's a lot of people who we've lost. And what drove that surge was fentanyl being introduced into the heroin supply primarily. Now there's some changes we're going to talk about, which are now affecting teenagers more than they have in the past. And so this is the context. And if you could show the next slide. Here, the same data, but really focused on age group, is represented in these bar charts. And youth, which we mean by youth is less than 25 years old, are only 1% of all deaths in Massachusetts, but they represent 5% of opioid overdose deaths. So among people who die from opioid overdose, young people, in this case less than 25, are overrepresented. So that's I think an important reason for us to think about overdose prevention in young people. So you can go to the next slide. There's been a surge in fentanyl overdose deaths among 14 to 18-year-olds. And this is a study that just came out this year that was looking at national data. And if you look at the panel A, you can see that gray line in 2019 taking off and going up super high, super fast. And that represents the death rate per 100,000 from fentanyl. And so all of a sudden, fentanyl has become this outlier as far as teen overdose death. It far exceeds benzodiazepines, methamphetamine, cocaine, prescription opioids, and heroin. And that, is happening much later than we saw the fentanyl surge here in Massachusetts. Now, it's not, all people are not affected equally. There are racial and ethnic disparities, and that's the right-hand panel, particularly people with American Indian or Alaska Native background. The next line there is orange, which is Latino or Hispanic. And they actually exceeded the death rates in white people for the first time. And then if you look at the line for Black or African American, their overdose deaths have actually, while lower than the other racial and ethnic groups, they've actually increased at a higher proportion relatively to the other groups. So we've got concerns in all sectors of our population. A big thing to note as you see this surge in overdose deaths is that adolescent drug use has actually largely remained flat since 2010. So the overdose deaths are doubling in the setting of the overall drug use largely remaining flat nationwide. And that really, I think, points to concerns around a toxic drug supply. And we're going to talk more about that. So next slide, please. So a little bit more on the availability, accessibility, and forms of illicitly manufactured fentanyl. So it's been detected in powders like heroin and cocaine, and counterfeit pills like Percocet or even benzodiazepines. But it's less present in drugs that are prepared in crystal or rock forms like crack or crystal methamphetamine. Although it has been detected in those drugs as well. While some people seek out fentanyl, many do not know it is present, and many more do not know how much fentanyl is in the drugs they use. And so that's really where the danger can come in. Where do people get them from? Well, there are connections to social media, online, peers, family, friends, street sales, and suppliers. There's multiple types of drugs sold and supplied, and less product differentiation. Really, what we've been seeing nationwide more and more is pressed pills, meaning pills that are made to look like prescription pills, but are actually counterfeit. They're made through readily available materials and supplies. One thing, the metaphor, this is Tracy Green, who you'll hear from later. Her metaphor is this chocolate chip effect, fentanyl, which if you think of a chocolate chip cookie, the chocolate is actually not evenly distributed throughout the cookie, but it's concentrated. And so when you bite into a chocolate chip cookie and your eyes are closed, which is what is happening when people are using drugs usually, you don't know how many chocolate chips you're going to get. You don't know how potent that fentanyl is going to be. It kind of depends on how concentrated it is in the particular sample that you may get, which we think leads to pockets of risk because the drug is not thoroughly homogenized. So this really big problem is inconsistency in contents, the amount of fentanyl present, and the difficulty in determining this in powders and especially pills. Next slide. So this is more data that just came out last week from the CDC. And again, this report noted that although teen illicit drug use has actually decreased from 2019 to 2010, overdose deaths increased substantially by 65%. 80% of these overdose deaths involve fentanyl, a quarter were counterfeit pills. Unlike adults, where many of the overdose deaths are related to injecting drugs, in the adolescents, it's more likely to be due to ingestion, smoking, or snorting. 2/3 of the time there was a potential bystander, but most were spatially separated and many were not aware of the drug use that was going on. And so this is where education and overdose prevention is really important, people need to know what to do when an overdose occurs and be prepared. Only 35% of the teens who died had a known history of opioid use that they could pick up after the person had died, and 41% had a history of mental health conditions or treatment. So that really points to a group that is particularly high risk. Next slide. Here are the recommendations that came out of the CDC mortality and morbidity weekly report. What we should be trying to do about teen overdose. So prevent substance use initiation and promote protective factors. Partnerships between public health and public safety to reduce the availability of illicit drugs. Expand efforts focused on resilience and connectedness of adolescents to help prevent substance misuse and related harms. Educate everyone about dangers of illicitly manufactured fentanyls, that's what IMF is, and counterfeit pills. Promote safer drug use for those who do use drugs, such as not using drugs while alone, having naloxone readily available, and using fentanyl test strips, which you'll hear more about. And then expanding naloxone access, training family and friends in overdose recognition and response, ensuring access to effective evidence-based substance use and mental health treatment. And examples of that are family-based and cognitive behavioral therapy and medications for opioid use disorder. Next slide, please. Okay, I'm going to turn it over to my colleague, Sarah Bagley.
Thanks, Alex. Hi, everyone. Thank you so much for the invitation to be here and talk to you. So I'm going to focus on how to talk to kids about fentanyl use and other drug use as well. I'm a pediatrician, and so I work taking care of with kids and with families who are impacted by drug use. So have these conversations pretty commonly, but also recognize that they can be really challenging to have too. Next slide, please. So as I was sort of thinking about preparing for tonight, one thing I thought I wanted to share was the way that I start sort of all of my visits with families and with patients, and sort of thinking about the framing. And I always asking this question, sort of why, like when I'm talking to a youth about their drug use, trying to understand, like, what are their motivations? What are the reasons that they might be using drugs or alcohol, maybe on the weekends, maybe every day? And the reason why I asked that question is because in my head, what I've heard from sort of colleagues too through the years is like behaviors make sense and people make decisions for different reasons. And the more I understand what those decisions are, the better advice that I might be able to give in partnering with a teen and their family about reducing the risks of alcohol and drug use. So often these are the kind of reasons or answers that I hear. Maybe because their friends are using alcohol or drugs, and so they're at parties, they're out in other social situations, and so it's just what's happening. Very commonly, and I would say more and more commonly, we're hearing about a lot of depression, anxiety, histories of trauma, and that by using drugs or alcohol, it sort of helps to allow for an escape, it feels like you're sort of treating those symptoms, and that provides enormous relief, even if it sort of has really significant risks as well. Also hear a lot about sort of isolation or boredom. I think especially during COVID, that was so common. And then also just when we think about teenagers, they do tend to be more impulsive. And so sometimes decisions around drugs or alcohol might just be made in the spur of the moment, not necessarily without a lot of forethought or planning or thinking about sort of the consequences of alcohol or drug use. Next slide, please. Great. I have a little bit of data to add to what Alex shared. And I'm sharing this slide just to put sort of in context sort of what youth or teen drug overdoses look like compared to the other leading causes of death among adolescents in the United States. And I think that what I find it really neat, this is a paper from this year. And so the different colored lines represent the different causes of death. And so what I want to draw your attention, and this is starting in 1999. So what I want to draw your attention to is the drug overdose and poisoning line, which is the purple line, and you see that it is, especially in the last few years, significantly increased and is now the third leading cause of death among adolescents in the US, behind motor vehicle crashes and firearm-related injuries. So I think there are a couple of important points. One is that these are all preventable causes of death, and there are ways that we can have public health responses to respond, but also that this is one of the leading causes of death for youth. And so it really should be sort of capturing our attention and asking us sort of what are the interventions that we can implement to change that curve. Next slide, please. And, sort of with this idea of why are youth deciding to try drugs, to try alcohol, I think that we know that a history of a mental health disorder is really common. So this is a table from the report that Alex was just mentioning that was released by the CDC last week. And so this is looking at mental health conditions among youth who had a drug overdose between July 2019 and December of 2021. And just want to highlight that 40% of them had a mental health history or some history of a mental health disorder. And so this is just a really high percentage of youth who have some kind of mental health disorder, some kind of opportunity potentially for like intervention that we can sort of think about how we want to include this in our overdose prevention strategies. Next slide, please. And here, I just want to highlight that as we're here talking about fentanyl tonight. I think the reason I'm talking about other drugs too is because what we know about teenagers is that they use more than one drug often at one time, and actually even when they're exposed to fentanyl, they may be actually trying, thinking that they're using benzodiazepines or stimulants or prescription opioids. And these are data that just show that most youth overdoses involve other substances. These are fatal overdoses. And that when we see that that happened in 2017, where most opioid overdose deaths among youth, the rate was higher when it was included another substance. And those substances are most commonly stimulants and benzodiazepines. And so as we think about responses to try to prevent fentanyl-related overdoses or opioid-related overdoses, we really need to think about other kind of substance use as well. And then finally, this is again from that CDC report, just that we learned in this report, it was just so important, and it was new data that we just there's been so little that we've known actually about what's happening with youth overdoses. But in this report, they shared that 60% of the fatal overdoses happened in the teen's home, with 2/3 of them having a potential bystander present, and 68% with no documented response by the potential bystander, and only 1/3 of the time was naloxone administered. And so I think it's just really clear from those data that there are a lot of opportunities for us to provide more overdose education and distribute more naloxone to high school, to teenagers, to their families, and be able to train people on how to respond when there is an overdose. Next slide, please. And so I think that there might be one slide before that. I think that, one thing I think that as we think about how we want to respond to rising opioid and specifically fentanyl related overdose deaths among youth, what can we do? So we can provide training so that people in the community are prepared to respond to overdose. We're going to hear more about that later on in the presentation. We're going to try to keep conversations and communication open with teenagers so they can have someone to talk to and to ask questions. And then I think finally, it can be easier sometimes, this is especially for thinking about parents or teachers or other people who work with youth, it can sometimes be easier to ask questions about what's going on with your friends. Or what's going on with their friends, rather than asking about their risk behavior. So what will you do? How would you want to respond? Are you ready to respond if you're out somewhere and someone is having some kind of emergency, or you're worried that they're intoxicated, or you're worried they're having an overdose? And so framing it about their friends and their social networks can be really powerful, because I think a lot of the teenagers that I talk to really want to be able to keep their friends safe. And so that's just that's an easier way to open that door and have that conversation. Next slide, please. I just want to highlight that for some youth, they may develop an opioid use disorder if they're using opioids regularly, including fentanyl. And just want to highlight here that the best treatment that we have for a youth with opioid use disorder is medication like buprenorphine. And so that is, you may be more familiar with the name Suboxone. This is evidence-based treatment for adults, but it's the same medication that we use for teenagers as well. And it's approved for opioid use disorder for 16 and 17-year-olds. And it's actually the only medication we have that's approved for this age group. And also in addition to medication, it's also really important, as I was mentioning, to diagnose and treat co-occurring mental health disorders and other substance use disorders. Next slide, please. So I just want to sort of leave with this quote from Maya Selvitz, who's a sort of well-known author and opinion writer in the New York Times as well. And she was the one who wrote this piece about sort of how to talk to your kids about fentanyl, which I recommend to everyone. So she said, in the long term, effective addiction prevention requires social change to prevent or at least intervene early in childhood trauma, creating communities conducive to mental health with safe, nurturing schools, stimulating extracurricular activities, and access to comprehensive health care. But first, we need to keep young people alive, and that means having uncomfortable, honest conversations about the danger of drugs and the ways to minimize the risk for those who use them. Thanks. I'm going to turn it over to Tracy now.
Thanks, Sarah, and thanks, Alex, and thank you, Dr. Kelly, for the opportunity to speak with you all. And today, I wanted to introduce myself. I'm Tracy Green. I'm an epidemiologist and professor at Brandeis, and I'm going to kind of pick up where you've seen some of the trends and some of the important conversation and turning points where with kids and parents can take towards prevention and treatment, and turn to some of the things we're learning about and some of the tools that you can maybe use in response. The trends are certainly concerning, and one of the ways that we can approach things that are scary is with more data and information that can help us really ground ourselves in what we know and be clear about what we don't know. So one of the things we've been doing in Massachusetts is actually looking to that drug supply to better understand it. So along with the Massachusetts Department of Public Health and CDC funds behind this, we developed a drug checking program, or community drug checking program, that collects remnant drug samples in the community. We also partner with police departments, so small amounts of substances that would be found in a packet, perhaps at a community space, or found at an overdose, and we gather that information, and then we actually test it directly on site. So we scan that with what's called an FTIR. That image of that device, an instrument, is on the left in the middle panel there. And then we also test with fentanyl test strips. That is all done on site, and we can detect the presence of fentanyl and other things in that powder or pill within about 30 minutes. And then the rest of that substance goes off to a lab off-site to do some additional testing, and then we interpret that to find out what in a human that would cause. And so we learn about the drug supply in this way and can report that back. All of the information is presented publicly and publicly available to both back to the community organization or the partner providing the data, providing the sample, and then we try to interpret them for trends. So I'm going to share back with you a couple of those, but I wanted to reflect this as a service that our community already has in place, and we'd be very happy to provide services to anyone in the community in Revere or partnered programs in the community to help gain some additional insight into what's happening in the drug supply. The next slide. The kind of data that we can gather from looking at the drug supply is really profound. So these are data that we put together from looking at samples across the Bay State. And just in 2020, when we began this, which was only about 4 months of data because of the pandemic, but we saw that across all the samples, and in the bottom, you can see the kinds of powders, pills, and other forms of substances that we were able to test, cocaine, counterfeit pills, crack, heroin, and methamphetamine. We could see the presence of fentanyl in those substances, and they were confirmed by laboratory testing. So just going across, you can see then clearly the orange part for heroin is the highest, right? So that in substance samples that were provided as heroin, 85% also contained fentanyl. But so this was also important to understand in other substances we might not be suspecting, like counterfeit pill or cocaine, powder cocaine. We also saw fentanyl in a presence of about 25% in both of those types of drugs. This is important because people who might be using cocaine or might be using a counterfeit pill might not be expecting to have fentanyl in them. And so based on this, we can organize a response that really thinks about detecting fentanyl and detecting other drugs and other substances we might be worried about, and then organizing a response accordingly. So the next slide, just to dive in a little more deeply on counterfeit pills in particular, because I think since we've seen such a large increase in counterfeit fake pill use across the country, including in New England area, one challenge is that we don't actually know. It's actually extremely helpful that the most recent reports have come out from CDC this week. But for the most part, we don't know from any given state. Fatal and non-fatal overdose data don't always find a pill on the scene. Either it's been used completely or it may have been removed. And so we don't always have a sense of whether a counterfeit pill was involved. So we actually think it may be, as you saw, 24% of the adolescent 10 to 19-year-old overdose deaths involved a counterfeit pill. It might even be much larger than that. And the data we have from drug arrests don't always detect whether the pill is counterfeit or not. And the manufacturers of pharmaceutical medications aren't really required to report whether the medication they're having reported to them about a health event or an adverse event, whether it was a real pill or a fake one. And so really what we get is from the media or from one instance or another, and we measure and we count in things that we shouldn't have to suffer, that people shouldn't have to suffer for a hospitalization or a death or an arrest, to understand that counterfeit pills are a major problem, or that any other substance in the drug supply. So this is one of the main motivations for community drug checking data programs like MADS, the Massachusetts Drug Supply Data Stream, that we've been building. And that way we can build off of what was already existing as remnant in the community and learn from it, because it's always been there. So the next slide is an example of some of the three pills I just pulled from different parts of the state. So at the top, you can see these are examples. They're publicly available. One of the labs that we work with is drugsdata.org, and you can go online and search Massachusetts, and you can see all of the substances that are tested as part of this effort. And you can also hopefully soon be going to streetcheck.org and see all of the data, including the drugs data laboratory work. But in this case, you can see top left that this Xanax or benzodiazepine presented and for testing. And when we tested it with on site and at the lab, what we saw was instead it didn't contain what you'd expect to see, alprazolam, but it instead contain bromazolam and clonazepam, which are two benzodiazepines that are not available and not meant for medical treatment as benzodiazepines would be. So it's not what you would expect to see in a Xanax. They're very strong synthetic and designer benzos, if you will. On the top right, you can see an example of a Percocet pill, or what an oxy, as some people may have called it at different times and places. And in this case, this pill was found to contain acetaminophen, or if you will, Tylenol, fentanyl, and two other precursor components that are meant for making fentanyl. So this is an unexpected tablet that was found in circulation in the community. And then the bottom left-hand one shows an example of a fake or a counterfeit Adderall. And in this case, it contained methamphetamine and caffeine. And these are examples of the kinds of pills that we test and have either provided to us by police department or by a community partner. And most of the time we get remnant, we don't get large pills or part of a pill, but these are examples of the kinds of things that we can reflect back in time, in real time, what was happening from 2020 to 2022, as you can see here. The next slide. And another kind of emerging thing we've been able to see are additives, perhaps, that find their way into the illicit drug supply that are important for anyone who might be using especially in this case, fentanyl. We have so much fentanyl and opioids circulating in New England in particular, that trends of drugs that kind of match onto or that we find in the opioid supply are really important to keep track of. And this one in particular is one we've been seeing increase since the pandemic. Xylazine is the way that it's pronounced. The X is pronounced as a Z. So xylazine is a veterinary sedative. It's not meant for human use. And so we've been seeing xylazine in trace quantities and now in more larger components of the particularly in the fentanyl or heroin or opioid supply, if you will. And that's all throughout the Northeast, much kind of, I guess, famously in the media around the Philadelphia area. But we've seen about a third of the drug samples that we see tested across the state that are sent in as opioids also contain xylazine in some amount. It's important because xylazine as a sedative is so sedating, and people may be found to seem and appear as if they are overdosing and unresponsive, and maybe not breathing. And so administration of Narcan and naloxone to revive the person who might have what seemed like overdose symptoms is the right thing to do. Administering naloxone in such an overdose situation like that is really important, but they may not actually become able to come out of their symptoms because of the heavy sedation that xylazine continues to persist in their body. So overdoses and tracking and keeping track of and making sure people are breathing and are cared for with 911 are really important. But the other thing we're looking at are sores and serious skin infections that can be associated with xylazine. We don't completely understand the mechanisms, but we are seeing more ulcers and acute skin infections that can get pretty painful and infected very quickly. So xylazine as an emerging component of the drug supply is something that we want to look for. And I have to say, just recently, we had a case in another state where exploring about the effect of xylazine. In this case, it was a young person who was found by their parent. They were not injecting, there wasn't sores or serious skin infections that was affecting them, but really they had been sedated for so long and hadn't moved. This veterinary sedative aspect of xylazine meant that the person had not moved in such a long time that the circulation to part of their body had been cut off. And there were some serious health implications associated with that, including potentially amputation. So I think part of the concern is being kind of aware of the health impacts of the drug supply, yes, on overdose, but also on other things that we want to make sure that people who are using drugs and who might be experiencing substances they're not expecting have the tools that they need to respond and to be prepared. So information like the ones that you see on the right are the kinds of notifications that we can create part of the drugs through the drug supply data stream. And this one, I think, importantly, is available in multiple languages, including English, Spanish, Portuguese, Twi, Vietnamese, and Haitian Creole. So multiple languages for communications that are important and relevant for many of their communities. The next slide. So the risks associated with youth, to kind of reinforce some of what Dr. Bagley was talking about, really the lack of awareness of fentanyl risk and pervasiveness of fentanyl in different forms, so like powders that you saw, are important. And that's something that we can address with knowledge and data, making sure we have accessible sources, some that are especially specific to age groups, that many of the sources of information are social media or online or peer and familial. So making accessible information to many people is really important. Social isolation and the inability or unwillingness to seek help is a challenge for all adolescent health, not just for substance use and mental health concerns. But in this case, using alone and with no one aware of their use can be lethal. Event and venue-based use, so people who adolescents may be using situationally in a party or in an environment where this environment might be less equipped or ill-equipped to respond to a medical emergency. And that if they are using publicly or with others, people may not be able to respond if they don't know or of the signs and symptoms, for instance, of overdose. For youth, we see that there are fewer skills for detecting drugs they haven't been using for as long, and the ability to have and self-efficacy or feeling confident to be able to ask questions, and understand and navigate the supply that they may be accessing is a challenge. And finally, they may be less likely to use sources for prevention and supplies and harm reduction, like a syringe service program, because they may not be injecting. So these are all more reasons that we need different kinds of responses. So the next slide. One of the key tools that we have for detecting fentanyl are simple to use fentanyl test strips. They're as you can see there, kind of they look almost like a pregnancy test, a very small amount of water to activate and a very remnant drug in a small plastic container here. You can be using to detect whether fentanyl is absent or present in a substance. And the next slide. Broadly, response strategies that focus on detection, like tools that a simple fentanyl test strip, and allowing people and encouraging people to take the time to identify and understand, for instance, if a pill is fake, and to be aware of those, what a counterfeit pill might look like. For instance, real pills don't crumble. The color doesn't come off on your hand. It would roll on a surface if it were made by a quality control at a pharmaceutical manufacturer, for instance. And fentanyl test strips can easily help be used to detect. Other prevention and empowerment approaches that emphasize connecting with trusted healthcare providers, like the ones that you've been hearing from tonight, and checkups to regularly keep in touch with the health of their body, and creating a whole health team. And that builds another confidential source to protect children and youth. The empowerment and nurturing the capacity to navigate the drug supply, and empowering people to be able to ask about their source and being aware of the risks. And that allows for tools like Narcan or naloxone to be carried, and to feel that that's important for them to take care of themselves as well as their friends and family who may suffer an overdose. And then thinking ahead and making that plan for prevention, or behavioral interventions or behavioral approaches that can be the difference between life and death. Next slide. The tools like this have no age limits, and there are no restrictions in Massachusetts to access fentanyl test strips, to access the drug checking program that I talked about, for non-prescription syringes at pharmacies or syringe service programs, for Narcan and naloxone, safer use supplies, wound care kits, safer injection kits, and syringe hygiene kits or condoms. And though organizations may differ on this, the access to all of these materials is not limited by age. The next slide. I thought this quote was really telling and helpful. When we started providing fentanyl test strips in the community, we did a simple evaluation and heard from a first responder who was distributing to family members as part of their community outreach. And he shared an experience that he had where talking with a mom who was really scared. And she said, I don't know if I want to give him, because now I'm giving him permission to use drugs. And the first responder says, walk that through. What if he buys drugs and he passes away? That's going to weigh heavy on you. And she said, you're right. Like, I can't control his outcome in regards to using or not using, but I can give him a prevention method, which is handing him this fentanyl test strip kit. So the kits are freely available at that website link. And I think my colleague, Brittany, will be talking more about that next. Next slide. Oh, I should say, if community drug checking is something that you or someone in the community would be happy to test a remnant sample, you can just contact us at the email address there. Next slide. I guess maybe just to close up here, but then Mr. Bowen spoke to collaboration. Better options like the supplies that we have give better choices for youth. And this is an extremely complex problem. It's going to have a complex response, but the partnerships like the ones that you all have been building will propel a much more effective response in the end. So I applaud you for the work that you've been doing and have yet to do into the future. Be happy to help you. Next slide.
Should I stop sharing or?
Brittany, do you,
Yeah, Diane, do you mind going just 2 more slides up? We're just going to add a few more things, and I am going to talk fast. So,
So,
this might be a different deck, actually, Tracy.
oh, next slide. Next slide, one more. There we go.
okay.
All right. I'm looking at different slides than you guys, so I'm going to go off of what I have. So you can go ahead and pull the slides down, and we can include that as a resource in our follow-up. But I just wanted to really quickly reiterate a few clear things. So who can administer naloxone in an overdose emergency at school? Any individual in Massachusetts can administer naloxone with their own naloxone. That's totally fine per Mass General Law. Also, all duly registered school health units can purchase, I'm going to get to that, and store naloxone obtained through the Department of Public Health and have that on hand for authorized healthcare providers in schools to administer during overdose events should it come to that. And, I'll just mention once again, you guys mentioned it before, but age restrictions for going to get naloxone at the pharmacy, no age restrictions for naloxone. So I mentioned purchasing. So for getting naloxone, aka Narcan, any municipal first responder entity, which includes police, fire, sheriffs, schools, are welcome to order naloxone at no cost from the Massachusetts Department of Public Health. At no cost to you all from us. You just need your mass controlled substance registration in order to do that. So police departments, fire departments, school departments, you are all welcome to reach out to DPH anytime to place an order for your naloxone to be prepared in the event of an emergency. We have community standing orders, pharmacy standing orders that really aim to minimize any barrier to getting naloxone from the pharmacy and to be able to give that Narcan out to individuals who may need it in an emergency. I'm going to tee up a few resources as well that I'm going to parlay it over to you, Julia, from Revere to just cover what else is available in your community, but wanted to make sure folks are aware of SBIRT, which I think I can share my screen. No, I'm not going to do that. SBIRT is Screening Brief Intervention. So we're going to send some information about that. That is available to schools. Also in Massachusetts, the Bureau of Substance Addiction Services, where I work, funds a number of initiatives. We have a program called Project AMP, which is enhanced brief interventions delivered by trained near-peer mentors. So we were talking earlier about the value of having peer-to-peer education, and that's about strengths and self-efficacy, etc. Sessions that occur in school-based settings, and there are mentors embedded in Revere High School for youth ages 13 to 17. There are also high school co-occurring response teams funded by the Massachusetts Department of Public Health, including a resource at the Revere High School through the North Suffolk Mental Health Association. And we also fund an initiative called the Adolescent Community Reinforcement Approach, ACRA, which is a behavioral health intervention for youth and young adults 12 to 24 that seeks to increase family, social, educational, vocational supports to agencies around the state. So we can include all that information in a follow-up through Julia's office. And Julia, I wanted to also just recognizing that this was an English language talk today, and that language is a barrier here today. Maybe give you the chance, Julia, to discuss any overdose prevention related opportunities, particularly available in other languages through the Revere Substance Use Disorder Initiative Office. So Julia, do you want to go ahead and weigh in?
Sure. Hey, thank you, Brittany. So those who don't know me, my name is Julia Newhall. I'm the director of the SUD and Homeless Initiatives Office. We used to be located on 437 Revere Street, but now we're located at City Hall in the basement level. Anybody who needs access to naloxone at any time can call our support line, and the number is 781-922-6069. It's all confidential information. It's free. You can just reach out to us, whether that be a bystander or an active drug user. We have a full-time outreach worker who I'm sure he's on this webinar. His name's Chris Alba. He is a harm reduction specialist, and he is very knowledgeable. He can come into any setting and conduct a overdose prevention education training. And actually, we're in the process of speaking of different languages, we're in the process of hopefully going to do videos in a bunch of different languages so that we can post them online and folks can have access to that information in whatever language of their choice. We're going to be partnering, I believe, with Revere TV on that. So thank you, Bob Dunbar. I'm just being cautious of the time. It's 6:52, and I want to make sure that we have enough time for folks to ask questions and answers. So Dr. Kelly, if you want to just open it up to the audience.
Sure. If anybody has a question, there is a Q&A button that you can drop your question into. There are a couple here that are about the language, not having translation services. But we are recording this, and we intend to have the transcript of this meeting translated so that folks will be able to get the information in their home language, and that's for Spanish, Portuguese, and Arabic, which are our three major languages besides English. So that will be coming shortly. And then there's a question about, based on the amount of packaging of the substance found at the high school, any indication whether this was intent for sale or someone's personal use. So I can say that it was one very small packet that was found and was handed over to the Revere police. And when we did our survey of the school using the trained canine units last week, we found the hits that we got, if you will, didn't yield any drugs. There was one backpack and 4 lockers that the dogs responded to, and none of them had drugs in them. They believe they were responding to a smell of marijuana. And as I mentioned earlier, Mr. Bowen and his team will be addressing that with those families and those students in particular. But I also want to, so I can keep watching for questions, but I didn't know, I wanted to invite Detective Sergeant Alfaro in to see if he had a few thoughts he wanted to share.
I saw the question from Anonymous. This is a continuing and ongoing investigation. So far what we have, the information we've gathered so far from speaking with the student that was identified as having dropped in the baggie. This substance goes by the name of Tussi, that's Tusi. It's a party drug, Tusi, and it's a pink powder substance. Presumptive test was done with, there was testing done at the school, but what we use is this right here. It's called a TrueNarc, and this is a method that we use to safely and effectively test it. Basically shoots a laser through the baggie, and it goes through a library of substances that have already been identified. And it gave us a presumptive test of MDMA, ketamine, and but the actual results we would rather get from the state lab because they have all the better equipment to do that. And the amount that was found does not indicate any distribution level amounts. It's more for personal use.
And I'll just emphasize that we don't know who dropped that baggie. It was found by a teacher. We don't know if it was a student or an adult or anybody else. We weren't able to trace it back to an individual. There is a follow-up question from Jennifer Manoli asking, why did the principal at the high school state that it was fentanyl? And I can actually answer this question because I worked on that letter with him. When we were told that the field test said it was fentanyl, we wanted to make sure we were giving information to parents as quickly as we could. And so we found out about the issue at 2:10 in the afternoon. We sent a letter home by 5 o'clock that evening, relaying the information that we had at the time. We both, Mr. Bowen and I, understand far more about these tests and how they work and the need to go to a state lab to have any suspected content validated. And, we worked through that with the police department. That's still underway. But at the time that the letter went out, I believe it said that there was some powder that was suspected to include fentanyl. I forget the exact wording. It was something like that. That is how we put the letter out. That is what we knew at the time. And that is what we were sharing with families because we wanted to be transparent.
It may contain it.
Okay. And I think Dr. Wally wanted to speak, and then Dr. Green.
Oh, thanks, Dr. Kelly. Just, this isn't responding to a question, but a point that I just wanted to make, which we didn't emphasize in the presentation, which is that the one drug that doesn't seem to be contaminated with fentanyl consistently or really at all is marijuana. And that's, I think in some ways, there are a lot of reports of marijuana contamination in the popular press, but not really a credible report of contamination of marijuana, and particularly not one that has resulted in an overdose, which is very surprising because marijuana is the most widely used drug, after alcohol, if you consider that a drug. So I do just want to make that point. Because the message we're saying here is that many things can be contaminated with fentanyl. We're particularly concerned about pressed pills and powders. But as of yet, and people have been looking for a long time, and there's been popular press stories, but when they've been further investigated, there really hasn't been credible evidence of any overdose due to contaminated marijuana. So I just want to make that clear. I'm not saying that marijuana is safe. That's not what I'm saying. I'm saying that as far as we know now, it's not credibly being contaminated with fentanyl.
That's great. Dr. Green?
Yeah, just to kind of extend that, one other really powerful tool is with fentanyl test strips is that conversation starter with parents and with kids, with any family member whom you have the opportunity to extend a fentanyl test strip and start that tough conversation. And that's really regardless of whether it's a pig powder or a pill or whatever it may be. And these are really useful for helping that conversation along, and to Narcan and talking about naloxone means talking about overdose, and that can be a hard thing to start with. But this is really about staying safe and knowing what's in your drugs, and having that people are worth talking about, and the fact that this is an extremely volatile time for the drug supply, and for young people to be exploring. But this is one of the tools we can use. So just wanted to mention.
Thank you. Danielle Day was asking about what we do at the high school in order to teach kids about these things. And I mentioned in our last letter to parents that we would be doing a more extensive education program after the winter break. But we have had Chris Herron come in and talk to the kids. I don't know if he's a former Boston College and Celtic athlete who found himself in trouble with addiction. And he comes in and presents to the kids. We've been doing that for a number of years. We did not do it in the COVID years, but those are pieces that we'll be re-engaging with. And our health teachers do a great job. This is a big piece of the curriculum that they work with kids on. I don't know if, Chris, if you want to speak more to that.
I think also want to name that we do a good amount of work in smaller group sessions as well. In addition to sort of these large group assembly type messages, we've done a good amount of work in terms of awareness around mental health. And many of the conversations in that area also speak to issues of substance use and substance use awareness. And so it is kind of embedded into that work as well. And part of our planning for the spring after the new year is to think about how some of this messaging is better done in small groups as opposed to in these large scale settings. And so what we're really trying to think about is how we get that word out there and engage with kids in size spaces or groups that are maybe better for students to be hearing more readily the information they need to hear.
And Dr. Kelly, can I just add one thing?
Please.
the city of Revere is partnering with the city of Chelsea and the town of Saugus on the Mass Call 3 grant. And they're in the early stages of strategic planning right now, but all of that funding from DPH is going to be geared towards primary prevention. So hopefully we'll have some strategies within the next 6 months.
That's great. I'm recognizing that we are a little bit over the time, and Milton has his hand up, and then Dr. Bagley.
I just want to mention this is an isolated incident, and the school has gone just above and beyond to prevent any future incidents like this. And we're here to help the parents. I'll post the drug hotline phone number in the chat if the attendants want to look at it. And just want to thank you for your time.
Thanks. Sarah?
And we'll be fast because I know we're late. I just wanted to say, you know, we talked a lot tonight about sort of different harm reduction tools like naloxone and fentanyl test strips. And I just wanted to say, sometimes a lot of parents will sort of say to me, like, how can we be, shouldn't the message be sort of just don't use it all? Or like, is that somehow sort of giving kids permission to use drugs? And just want to say that what I say back is like, look, I think we can have conversations that are hard and honest with kids and say, on one hand, the safest thing for you to do is to not use drugs or alcohol. Like that is going to be the safest way to sort of prevent an overdose. And if you are using drugs or, you know, using drugs, or you're in situations where your friends are using drugs, we want to make sure that you have all the tools to try to keep yourself as safe as possible and respond. And so like, I don't think to me, they're not like mutually exclusive. Like you can give both, you know, you can give all of that information. And the goal, I think, is this shared goal of trying to keep kids safe. Like that's kind of the shared goal, no matter sort of what perspective you're coming from.
Right. And I mean, our take in the schools, I think it was Danielle said in the chat too, that it's illegal to use drugs or alcohol until you're 21. And that is certainly true, but we know the reality is that there are a lot of kids who are not 21 who are drinking or smoking or doing some combination of both of those things. And often doing a combination of any one or both of those things leads to other things. And so making sure kids are aware of what they might be encountering, especially if they're in a new environment with different friends that they might not know too well, protecting them and making sure they have some information is really important. And that is the message that the kids get in their health classes. It's stay away from all drugs, stay away from alcohol, but really giving them the tools and helping them understand what it could mean, what the consequences could mean for them if they were to engage in what they thought was some kind of a recreational game. It really isn't. So I am going to thank our guests. I want to say actually to our friends at WEE that we will be having this translated so that our families can access this talk in other languages. And if you could get the word out for us, that would be great. Mr. Bowen, any last words?
No, I'm thankful for everybody's kind of mobilization around this so quickly, and look forward to future communication with you all in the Revere community.
Thanks, everybody.
Thank you.
Thank you. Take care.